Thank you, and allow me first to say how much of a pleasure it is to be here, and a privilege to sit on this panel. It's really great to witness over the years the progress that has been done, and I really want to commend Mr. Minister for his leadership over the last year and a half, and the acceleration in the program and the progresses and the collaboration between the ministry, the Hellenic Medical Oncology Society and the president, as well as the Hellenic Federation of Cancer Patients. I think we all work for patients, but it's humbling to see that under your leadership and the collaboration that you're showing, patients really have a voice and are present, and really that collaboration, we're not seeing it everywhere necessarily in Europe. So it's very humbling to just hear what you just shared, I have to say. I would like to touch on maybe three themes as part of my opening remarks, and you touched on some of them, of course. One is the fact that cancer is predicted to be the leading cause of death in Europe as demographics evolve, and how do we try to tackle, and what does it mean for all of us in Europe and in Greece. The second theme, and you touched on it, is the importance of innovation and competitiveness. Competitiveness is probably the center word over the last weeks beyond the healthcare, but in healthcare it's also extremely important. And the third theme I'd like to touch on is collaboration. And we just, see collaboration in action through a number of examples that you've shared, and how those are important within a country, but also broader in Europe. So on the first theme, reality is that the prediction are that as many as 1 in 2 European citizens will experience cancer in their life. I mean, that is also a statistic that gets us, to step back and reflect. And we're seeing significant advances. You spoke about the fact that there are more and more survivors, and that is thanks to improvements in prevention, in early detection, diagnosis, in treatments, in care. We have multiple examples that I could use there. I mean, recently the American Cancer Society showed that in women vaccinated against preventable cancers, there was a decrease in 70%, 69% exactly, of cervical cancer from 2013 to 2021. If we look at early detection, breast cancer patients that are detected early, 9 out of 10 have a chance of surviving. If we look at new therapies, we see, for example, in metastatic melanoma that 5 years survival is now up to 50%, I think, compared to 5% some years back. So we see progresses. Now, having said that, I mean, more needs to be done. We need to continue progressing, and on multiple fronts. On the front of innovation, but also, and you touched on it, on the front of equity. What we see across Europe and within countries is inequities in terms of results within socioeconomic groups. We see that, for example, there's an interesting statistic that 10% of the EU citizens would say that they delay getting care because of financial restrictions, despite the fact that largely in Europe we have universal care provided. But when you go a little bit deeper in that statistic, it goes up to 20% in people that report low income, compared to only a few percent in those that obviously have a higher income. So there's a lot to be dealt with. The other aspect that is important and is really to witness the progress that you've all touched upon. I think it's impressive to see that you've had progress in prevention in Greece, in multiple now screening programs, whether it's breast cancer, cervical, colorectal, whether it's the work that you're doing with the National Registry I mean, this is paving the way for significant transformation and for the ability to use data also in the future for more evidence-based decisions. It's also really humbling to see the progress that you're doing around digital solutions. I mean, we talk a lot about digital solutions, but having Greece today and patients in Greece being able to have access to digital solutions, being able to be managed through the entire healthcare system in the future, being able to have their medical dossier access, whichever physician they will consult in the future will be key. So I think we see progress, but more is needed. On innovation and competitiveness, I mean, maybe just 2 points I touched on. One is at the time that we're really seeing how important it is to have a strong Europe. I mean, the EU, the pharmaceutical industry invests 23% of the global research in Europe. It's not a bad number, but it's decreasing over the years. So we need to continue under your leadership having strong regulatory framework in Europe and incentives to be able to drive research. I mean, because when we have that vision and when we work in such a collaborative fashion as we do in Greece, even though not everything would be perfect, we see that we're able to do a lot. A company like ours in Greece, we have the largest clinical footprint in the country. There are more than 71 clinical trials at the moment that we're running in Greece, close to 500 patients in clinical trials, 60 of them in oncology, some in our most advanced investigating medicines, like our neoantigen therapies, and a colleague of mine will talk about it this afternoon. So we can do a lot. And developing a comprehensive cancer care goes from research, from the bench, to the bed of the patient. And that whole ecosystem is what leaders like yourself are trying to build, and that's what we as a company are committed to contribute to. And that brings me to my last point, is really the importance of collaboration, partnerships. We here in the room, I recognize a number of people. Just as we were starting, I was discussing with the WHO lead. I mean, we need those partnerships between public, private, scientific societies, large organizations to come together and really help build comprehensive cancer care. So I'm really looking forward to the conversations throughout the day. And thank you again for your leadership and having us here.